Good day, viewers and listeners, and welcome to the COVID-19 update for today, Thursday, January 13, 2022. I am Godfrey Brooms.
And I am Shania Gonzalez. Today we will be speaking with the Minister of Health, Dr. Frank Anthony, about Guyana achieving its major milestone in its vaccination campaign.
So in Region 8, we have a number of vaccination sites, and we have mobile teams that have been going out into the various communities to get people vaccinated. Unfortunately, Region 8 is one of those regions where we faced a lot of hesitancy in some areas, and despite going to some villages 6 and more times, we continue to see this pattern of hesitancy. Nevertheless, the health team would continue to try and encourage people, educate people on the reasons why they should get vaccinated. Well, if they're not wearing masks, keeping distance, then they're going to get infected. Unfortunately, what we have seen is that the persons who are unvaccinated, and if they have comorbidities, unfortunately, they're the ones who would end up in the hospital. We are getting far less hospitalization now, but if you're unvaccinated and you have comorbidities, then you would be at a much higher risk of getting hospitalized if you get COVID. So again, I would like to urge persons who have not been vaccinated as yet to make sure that they go out and get vaccinated. We have vaccines available at all our sites, and so it's not a difficult thing to get. So as of yesterday, we got 1,186 new cases, and right now we have 8,680 active cases. So in Region 1 we have 90 cases, Region 2 we have 201 cases, Region 3 we have 1,004 cases, Region 4 we have 5,378 cases. Region 5, 245 cases. Region 6, 639 cases. Region 7, 266 cases. Region 8, 18 cases. Region 9, 300 cases. And Region 10, 539 cases. Well, we have a special team within the ministry that is working on the digitalization. We have got most of the physical registers, and we are now putting that in a digital format. A lot of the work has already been completed. Since last year, we have been working with UNDP to buy some of the equipment that is necessary, the computers, the specialized printers and so forth. So we expect that we would get delivery of those special equipment to print the new cards within the first quarter of this year. Well, we do have a lot of Sputnik V second dose in the system. So we have adequate supplies. And at this point in time, there's no need for us to go and buy additional doses of Sputnik V. We have enough in the system for those who would want to get vaccinated with Sputnik V. Well, first of all, I think all workplaces need to adopt rules that make the workplaces safer. So those rules would include employees who are on the job to wear a mask, especially an N95 or a surgical or procedural mask. If you do that and you do that consistently, then the environment is going to be much safer. If you're working in an indoor environment, it ought to be very ventilated. People need to keep social distancing. And of course, we want to make sure that people are fully vaccinated. And if they got both doses and eligible for the booster, that they should get the booster. With these measures, once implemented properly and consistently, I think most workplaces are going to be safe. Problem though is that in many instances, people are not complying with these simple, I would say, measures, and therefore we have to monitor more compliance. And I think if workplaces do that, both public and private workplaces monitor compliance, then we would see a drop in the cases. We have selected the samples. We are now at the process where the agencies are making the arrangements for the shipping. So as soon as those arrangements are concluded, we will be able to send the samples. Yesterday, I think we broke a record in terms of vaccination. We were able to administer 3,706 vaccines, and that then gradually increased some of our totals. So right now for adults, first dose, we have 416,353 persons who would have received a first dose. That's now 81.2% of our adult population. For second dose, we would have administered 302,704 doses. That's about 59% of our adult population. And in terms of the 12 to 17 age group, we have completed 31,437 doses. That's approximately 43.1% of that age cohort. And for second dose, it's 22,259 doses, or 30.5% of that age cohort.
This has been the COVID-19 update. For more information, you can visit the Ministry of Health's website at health.gov.gy
or DPI's website, dpi.gov.gy, and our social media platforms. Godfrey Brooms on behalf of myself and the Shania saying goodbye for now.